What is informed consent? Physicians and patients often have questions what it means to make a fully informed healthcare decisions. In the context of FJH hospital clinical departments and policy states, it's an agreement or permission accompanied by full information on the nature, risk and alternative of a medical procedure or treatment before the physician or other healthcare professional begins the procedure or the treatment. After receiving this information, the patient then either consents or refuses such a procedure or treatment. Obtaining an informed consent is mandatory in FJH hospital, where medical or surgical procedures, anesthesia, blood transfusion, all invasive procedures and related treatments are performed by the treating physician or designee. In case of emergency situation which requires immediate treatment and intervention to save patient's life, the treating physician or designee shall be obliged to fill the consent authorization form for performing treatment or procedure in emergency situation form. Handle the situation in the patient's best interests. Adhere to the rules of best medical practice. Use the minimum necessary intervention and make efforts to reverse or minimize temporary incapacity. In any medical legal requirements, a written consent shall be obtained from the patient by making sure the patient has full legal capacity. In case a patient is not competent to consent, the treating physician must clearly document in the patient medical record the grounds on which he/she has reached this decision, and the consent shall be obtained from the patient's next of kin, up to the 4th degree. The treating physician or designee shall complete the informed consent by considering the following. Once the consent is obtained and signed, it remains valid for a period of 90 days for adult and pediatric patients. The valid consent is 1 year for chronic dialysis patients, and patients receiving chronic blood transfusions in the Thalassemia Center of FJH Hospital from the date of issue provided. Let's talk about patients' privacy and confidentiality. To respect patients and family members, even visitors' rights to privacy and confidentiality during examination, procedure and transport, and ensure patients' consent before being photographed and recorded in any process which may lead to disclosure of information. All healthcare providers shall respect patients' values and beliefs, shall identify any specific patient expectations and needs for privacy during care and treatment. Staff shall not discuss patients' information with any member outside the healthcare team, shall respect patient confidentiality by not posting confidential information during conferences such as photographs or records without patients' consent. All healthcare providers and trainees are not allowed to photograph patients with their own phones in FJH hospital premises. In any procedures that requires photos and videos for medical purposes should only be taken by the assigned, responsible person. The physician shall explain the patient or legal guardian about the purpose and ask the patient consent of medical photography and file to the patient medical records. The patient's involvement. The benefits of patient's involvement in the care process increase and empower patient involvement in care decisions that affect their healthcare services and treatment, and their right to participate in the extent they wish, support and promote patient and family participation in care process and the expected outcomes of care. Patients, family as appropriate, and staff involved in the patient's care participate in the discharge planning process. The roles of healthcare providers at FJH Hospital is to ensure that they provide education and any relevant information to their patients and their families in a language they can understand. In situations there is a language barrier, the staff shall use the interpreter list in FJH Hospital shared folder. When the language of the patient is not included in the interpreter list, the embassy of the patient shall be contacted to provide education and any relevant information to the patient or families in a language they can understand. The patient's rights. FJH Hospital leaders do for the patient's right. Adopt and understand the list of patients and family bill of rights and responsibilities. Ensure the staff are aware, able and implement the patient's and family Bill of Rights and responsibilities as applicable to their organization. Respect patients' rights to have the privilege to determine what information regarding their care would be provided. FJH hospital staff shall hand the patient and family rights leaflets to patients when the patient opens a file for admitted patients, and comply with any specific federal or local government requirements in relation to patients' participation in the national screening programs. The compliance will be demonstrated through patient signature against federal and/or local government requirements for screening programs documents. Use of restraints. Restraint is the use of a physical or mechanical device to limit or prevent movement of the whole or a portion of the patient's body, preventing harm by a patient to himself or others, and where less restrictive methods have been evaluated. Promote a feeling of security in a patient who needs control. Applied for the shortest period of time possible. Never be used for discipline or for staff convenience. Restraint orders cannot be written as PRN. Use associated with medical, dental, diagnostic, or surgical procedure when such use is based on standard practice for the applicable procedure. Types of restraints. Physical restraints, any manual method, physical or mechanical device, material or equipment that immobilizes or reduces the ability or a patient to move his or her arms, legs, body or head freely. Mechanical restraint, any device, material or piece of equipment attached to or near a patient that the patient cannot control or easily remove. The intent is to restrict the patient's free body movement and/or normal access to their own body. Environmental restraint, barriers or devices that limit patient ability to move about and confine to a specific location. Also, secure areas or outdoor spaces, barriers in doorways. Pharmacologic restraint, medications given to control behaviors and actions and/or restrict the freedom of movement, and not to treat a specific medical condition. A clinical assessment for the use of restraints shall be done by physician. Explanation to the patient's family the need for the restraint and initiate an order in EMR. Conduct a personal examination of the patient with restraints will be done, and thereof regular and periodic observations. The progress note shall be written on patient's EMR in every assessment. Patients under restraint shall be continually monitored, and nurse assists the doctor in safely initiating the restraint and will be released after some time needed, ensuring the removal of potentially dangerous objects away from the patient.